Hi friends, I'm Nurse Mia. Welcome back to my channel and to part 3 of the Med-Surg RN chapter NCLEX review in the Zen RN study group series. In this video, we are breaking down the 15 NCLEX clinical judgment domains and showing exactly how they connect to the Med-Surg chapter you are already studying. We will walk through each one step by step so you can finally see how NCLEX thinks and how to answer them. If you are being overwhelmed and unsure what the NCLEX really wants from you, this might be the missing piece. So take a breath, open your notes, and let's make the NCLEX feel a little bit less overwhelming. Let's do it together. Let's get started.
So we are in chapter 21 and we'll talk about multidrug-resistant organism. I hope you enjoyed the outline summary and the terminology and make easier for you to answer those questions. So as we know, here is the NCLEX. This is the candidate performance report, the CPR, and here we have the NCLEX pi in order to pass, but you see it's like here it says like 15 to 20%, 10 to 16, so the percentage is little bit, so little question here, little bit question in there, and then those kind of apply to all of this here. Download this booklet. I have it down below, but also on their website. So this is the latest and ends in March 2026. Then we have something new, probably regarding AI or something like that, since we're in new AI era. So the NCLEX is broken in 15 specific areas. It's not just about knowing your content. Think it's about knowing how to apply in different situations. So those domains include the traditional 8 categories like management of care, you see pharmacological, basic care and comfort, etc. And plus the 6 steps of clinical judgment, which is a huge focus of new exam. And this is somebody that posted, I took a short screen from Facebook group about NCLEX, and says like it's the second time, but some other people there for more than 2. Here in California we do stimulations to see where you are and kind of give you a predictive from ATI, Kaplan. They do those prediction kind of where you are lacking, and you, not you specifically, it's like the person who is taking the exam, the test for that type of test will tell where is located the low points, and then just the person needs to see and remediate those questions and can understand why I answered that and that. And those simulations, they are really good. And actually, even I don't know if you ever heard about Lecturo. Lecturo, it's another place that you can learn osmosis also, but in Lecturo they have actually this year in 2025 in April, end of March, April, they had for 2 weeks a stimulation. It was a long exam and could see, and I took it to see where I'm standing, like this stimulation was for free, so it was fun to see. And then 2 weeks later I took Kaplan, and actually both of them, they gave me the same score and kind of similar areas what I was lacking in Lecturo, there also I was lacking in Kaplan. So basically, I took two different stimulation, and I saw very, very close similarities where actually were my mistakes. So the exam, they were totally different, but the areas of exam, it showed me like which from my pie I was lacking. So to move forward, you go, it's good to go and see and get better on that. So that's why I want to organize my notes around those 15 domains, and I can learn how it plays them into the correct context for the exam. So the making connection to critical judgment right here, the recognizing cues, it's about what clinical manifestation are observed in the patient or that patient from the case study. So what clinical manifestation? So that is recognizing a cue. Analyzing a cue is how do the clinical manifestation correlates with the underlying pathophysiology. Prioritizing hypothesis. How could happen if these patients' symptoms are not effectively managed? So prioritizing hypothesis, what could happen if? So that's why, and then I have questions about those. Generate solution. What treatments are included to manage this patient condition? So it's generate solution. What treatment? So this is like to me like all the select all of the apply. Taking action. What are the priority intervention for this patient? So remember those questions. What is the most important? So that is the priority intervention. And then evaluating outcomes. What findings demonstrate that the treatment plan is effective? So what follow-up data are needed? So in this chapter 21, infection due to multi-drug-resistant organisms can usually be successfully treated with antimicrobial therapy. Once the infection has been treated, the patient's viral signs and labs values should return to within normal limits. Patients also should know the importance of finishing their antibiotic regimen. Those typical questions. Oh, I took antibiotic 2 days. Now I'm just fine. I should not take it. So that's it, patient teaching. They need to finish their antibiotic regimen to prevent the reoccurrence of infection. So sometimes when a patient, they don't treat properly an infection, either they don't or either halfway. That's why the germs gets stronger and stronger, and now you need the antibiotic stronger and stronger. And patients and families should also know the clinical manifestation of reoccurring infection to know when to seek health care. So here also imagine when something happened in my computer, but yeah, teaching the patient and the family, it's very important, especially for this chapter, I mean, for this situation of the patients. So now we go more into examples of those little domains and then practice questions, and then you understand now the definition, and then we make a question based off this definition. And here we have the pie that I just talked about, the pie, and this is likely testable topic from chapter 21. In this one is like kind of from quizzes that I've been taking, I've been seeing what kind of ask me, and then and each question on those books, it says oh, this is management of care, this is health promotion and maintenance, so you kind of know. So there I get my little notes from my table. So just this is kind of remediation, so I take from those chapters, end of book quizzes, and then there I remediate the questions, and then I make my own little notes. So they are there from you see here, isolation protocol, airborne contact. This is very, very important. So decide when isolation is needed. So you need to decide when. Choose what task stays within RN, prioritize infection precaution, and patient education. Assuming unlicensed personnel can teach about antibiotic therapy or infection control. So those are those questions when you, as an RN, you delegate who goes to the CNA, what goes to LVN. So the RN is to teach. Then the safety and infection, hand hygiene, the PPE use, you see the MRSA, and then identify best infection prevention strategies, and then causing airborne versus confusing airborne versus contact. This is huge here, and you see safety and infection. Clinical judgment, it's prioritized cues, fever, culture, drainage, and then failing to escalate care for infection-related hypotension or delay antibiotic response. And here is select the most urgent cue, example, rising lactic acid, predict outcomes or missing precaution. So now we're moving forward. Here you see keys of multi-resistant organism infection, control priority. So this is from again from PI, and I make more little bullet points, more examples. I try this time to be a little bit different than I used to make more tables, but this is a different way. Nursing responsibilities. So here it's NCLEX management of care and clinical judgment. Prioritize hand hygiene, maintain contact isolation, administer antibiotic as orders. Let's see, PPEs. You see here for the GI to decrease the stomach acid. Then avoid over prescribing to prevent new resistance. Gown and gloves. Here in outline, I always I wrote in the last slide about safety alert, like must. MRSA are found in both community and healthcare settings. Common infection, pneumonia, SSDI, surgical sites, bacteremia. Moving forward. And here we start with hypothetical case study. Most of the books, they have a study like this, but I think in NCLEX they say adult. They don't say names. 72-year-old male is admitted from a skilled nurse facility. So he's admitted from a skilled nurse facility to the hospital with a fever 103.3 Fahrenheit, confusion and fall, smelling urine. So definitely has infection. Past medical history include type 2 diabetic, hypertension, and chronic kidney disease stage 3. He recently completed a course of CyPro for previous UTI. So looks like it's yeah, here, you know, when somebody has a UTI, an infection, then the antibiotic gives you as a side effects another infection. Urine analysis reveals purine and bacteriuria. Blood culture and urine culture are sent. The next day, lab confirms a diagnosis of a multidrug-resistant Klebsiella pneumoniae infection. So the CRE, the Vancomycin-resistant Enterobacteria CIE. So he is placed on contact precaution. Nursing staff are instructed to implement the isolation protocol. Okay. The infection disease team recommends treatment with meropenem vaborbactrum. So our patient becomes increasingly weak and has diarrhea. Stool testing is positive for C. difficile toxin. Okay, so that was our study case. So we have 15 questions, and now we go about the case study, and also later we go through kind of a chapter. So the first is like from our PI, safety infection control. The nurse implements contact precaution for our patient, which action demonstrate proper infection control. Placing the patient in a positive pressure room, wearing gloves and gown upon room entry, assigning our patient to a shared semi-private room, definitely not. Encouraging the patient to ambulate without PPE to avoid deconditioning. So wearing gloves and a gown upon room entry. So wearing gloves and gown for contact precaution. It's correct for CRE and S. difficile. Question 2, we have here clinical judgment and recognizing a cue. I said the definition already about recognizing a cue. Based on our patient condition, which nursing actions requires immediate intervention. Assessing the patient with oral care. Notify the provider about new onset diarrhea, encourage fluid intake, placing soiled linens in a biohazard bag. I think it's very obvious in this question. So the new onset diarrhea in a patient on antibiotic raises concern for C. difficile. So here we have management of care, infection control policies. Which diagnostic finding most supports the plan to initiate contact precaution for CRE? Positive blood glucose, low potassium, urine culture showing this negative chest X-ray. I think it's so obvious, this question. So correct answer is urine culture showing because it's at risk, because it's here initiate contact precaution. So we have to look for the contact precaution in this question. In here we have psychosocial adaptation and prioritized hypothesis. So here you get from that CPR like those two, but it's one question and gives you point for this and this. What is the priority nursing diagnostics? So priority nursing diagnosis for our patient at this time. So this is the plan of care where nurses has those diagnostics. And in my outline, I put there in one of the slides a list of. So here it's a risk for falls related to advanced age, risk for impaired skin integrity due to diarrhea, risk for ineffective coping, impaired urinary elimination related to infection. So it's talking about nursing priority. So it's impaired urinary elimination related to infection. So it's the most immediate concern is infection and urinary dysfunction. Here we have the health promotion and maintenance. So patient staff education. We do the teaching. Which education would the nurse provide to staff caring for the patient? Hand hygiene with alcohol-based rub is sufficient for C. difficile. The SRE is spread through droplets and need airborne isolation. Contact precaution must be used. Hand hygiene should include soap and water for C. difficile. The staff must double glove when caring for patient. So correct answer is contact precaution must be used. Hand hygiene should include soap and water for C. diff. So C. diff requires soap and water infection for contact precaution. In question 6, domain evaluate outcomes, clinical judgment here. Then the nurse evaluates the care has been effective when which outcome is observed. When which outcome is observed. Patient verbalized anxiety related to isolation. No further episodes of diarrhea are reported. So this is evaluate outcomes and clinical judgment. The nurse evaluate. The care has been effective. True or false? Patient verbalized anxiety related to isolation. It's been this effective. No further episodes of diarrhea are reported. Is this effective? Yes or no? Blood pressure is stable at 110/72. True or false? White blood cells count remains unchanged. no further episodes of diarrhea reported, especially because we do the state the case study, but in NCLEX also I saw somewhere that they have like around 16 to 18 case studies, and each of them. But I think I heard somebody said that they had 6 case studies in the exam, and that person passed, but had 6 case study. So that's why I started to make those case studies and questions, like nonsensical questions. This is just to kind of get practice and practice. So now domain leadership, management of care. The RN is supervising UIP, which is the CNA, the caregiver, providing care to a patient with a draining abdominal wound infected with MRSA, which action require immediate intervention. So here right away you know that it's management of care and leadership, which is a big slide off from the pie, supervising and what action require immediate intervention. So something the CNA did and the RN is supervising, and now the RN has to kind of intervene. So the CNA places the patient's soiled linens in a biohazard bag, enters the room without wearing gloves, asks the nurse to clarify when the use of isolation precaution, assess the patient with hygiene after donning PPE. So enters the room without wearing gloves. So violates contact precaution for MRSA. This poses a safety risk to the CNA and others. 8. Domain pharmacological and parental therapies. A patient with VRE is prescribed IV linezolid, which assessment finding would prompt the nurse to contact the provider immediately. Heart rate, complaints of headache, the platelets count, urine output in 8 hours. So it needs to be 30 ml per hour to kind of know when. So the platelets, because cause the thrombocytopenia, a platelet count of 49 is critical low and increases bleeding risk. So domain health promotion and maintenance plus teaching. So the nurse is teaching a patient with C. diff for how to prevent reinfection at home. Which teaching point is the most important? What is the most important here? Use alcohol-based sanitizer before meals. You can stop antibiotic once symptoms resolve. Wash hands with soap and water after using the toilet. Avoid probiotics while on treatment. Wash hands with soap and water after using the toilet. I mean, this should be not if the patient is with C. diff. Wash hands with soap and water after using the toilet every day, every time. Not just with C. diff. C. diff spots are resistant to alcohol-based sanitizer. Hand hygiene, hand washing with soap and water is essential. Here, many people had the problem with basic care and comfort and safety. Here is a question. A patient colonized with Acinetobacter, I call it AB, right? Baumani. It's complaining of dry mucous membranes and dizziness. The CNA reports no fluid intake for 6 hours. Definitely is a concern. What is the nurse's priority action? Document the findings and reassess later. Oh yeah, we just let you sit there and you are dry mucous membrane and this dizziness and no drink fluids. Yeah, I just document. Notify the provider to increase IV fluids. Encourage the patient to drink water. Ask the CNA to offer all oral fluids and record intake. So encourage the patient to drink water. Encourage oral intake is the most immediate nursing action to address symptoms of dehydration, especially in a patient with no restrictions. So because didn't drink water, is dehydrated, dry mucosa membrane, and then you notify the provider. Not necessary to increase in IV fluids, you notify the provider what we should do next, and this it happened to the patient. I don't know if you guys hear my neighbor's dog, it's screaming outside. So here is just from the chapter itself, the case study is finished. This is just from the chapter, which multidrug-resistant organism is commonly associated with ventilator-associated pneumonia in ICU patient. CDEF, the AB guy, the VRE, and the MRSA. So it's the AB because it's highly resistant and frequently causes ventilator-associated pneumonia and bloodstream infection. Another question from the chapter, a patient with sepsis has a lactate level of 5 micromole per liter and a blood pressure of 80/50. Despite receiving fluids, which stage of sepsis does this indicate? I had it in the outline, a slide, and at the end I said like, oh, this is my flashcards. There it says the early severe and septic shock. So the septic shock is defined by persistent hypotension, dispute fluid resuscitation, and elevated lactate levels, indicating organ dysfunction and poor perfusion. We are in 13, so we have 2 more to go. Except this question is except from multi-drug-resistant organism transmission. Which of the following does not require strict contact precaution? So, which of following does not require strict contact precaution? The C. diff, MRSA, TB, and VRE. So it's the TB. TB is transmitted via airborne droplets requiring airborne precaution, N95 mask, negative pressure room, no contact precaution. So here it was the tricky one. 14. A nurse is preparing to administer antibiotics to a patient with carbapenem-resistant Enterobacteriaceae, CRE. It's better to say CRE infection. Which drug class is the best choice for the treatment? So I said some meds on this. So it's beta-lactams carbapenems, polymyxins, fluoroquinoles, polymyxins. It's it's highly resistant, often requiring polymyxins and or tigecycline as last resort treatment. So this is like pharmacological, because we talk about administer antibiotics, and here is the medication and which drug class is the best choice for the treatment. So this it's pharmacological. Here it's a quiz taking, fill in the blank. But here in NCLEX they say to choose, and they have a box here with 3 or 4 choices, so you have to kind of choose from 4 to put it here. The first nursing intervention for a septic patient with hypotension and lactate level more or equal than 4 millimole per liter is to initiate therapy as soon as possible. So here, early fluid resuscitation is critical in sepsis management to improve perforation and prevent organ failure. Okay, so now I'm checking out, and I want to tell you my last thoughts and thanks.
Thank you so much for being here with me today. I hope this video helped make things feel a little clearer and less overwhelming. If this supported your learning, please give it a like or share it with your fellow nursing students who might need this too. Everything we cover connects back to the real nursing, wherever it's recognizing a lab, planning safe care, or knowing what to teach a patient. Let me know in the comments below, what was the most helpful thing you learned today? What still feels unclear or confusing? If this was what you hoped, and make it easy for you. If you can also let me know if you like the notes for this chapter. Check the description. I usually add some free resources there just for you. Thank you again for your time and trust. I'm Nurse Mia, and from my heart to yours, until next time, stay zen, stay grounded. Namaste. Bye for now.